I didn't need these last year. Thank you, Tino. Good morning. I'm Kim Wolfe, the Executive Director for Lifepath Hospice. My family has called me a nurturer for as long as I can remember. As a child, I cared for my stuffed animals as if they were living, breathing creatures. Before leaving school, I made sure they were comfortable, heads propped up on pillows, tucked under a blanket. In my early 30s, I started my career at the rehab unit of Tampa General Hospital. While I thought I was doing a great job there, my nurse manager continually corrected me. Kim, you cannot keep dressing, feeding, repositioning your patients without them doing the work themselves. You have to encourage them to gain their own independence back. My manager knew my nurturing heart was geared for patients in crisis and pointed my career towards pediatrics. Watching people suffer pierces me to the core and creates a drive within to make a difference in their story. So when I got the call to join Lifepath Hospice, I did not hesitate. And when I say call, I mean both the phone call and my life's calling. I have a poster hanging in my office that says, because care of the body first means easing the soul, hospice workers are not hired, they are called. And today, along with 350 of my hospice colleagues, we are answering a call to care for loved ones near end of life. When we enter a family's story when hearts are broken and spirits are down, we not only care for our loved one's body, but their mind, their spirit, and their soul. A team of doctors, nurses, social workers, chaplains, home health aides, and volunteers will enter patients' homes with loving families at their beck and call, as well as homes without another soul to love them. We will meet patients at a local coffee shop or under a Tampa City bridge, if that's what they call home. We will care for those who have a robust income and insurance, as well as those who don't have two pennies to rub together. This November marks 40 years that Lifepath Hospice has been serving Hillsborough County. In 1983, Lifepath cared for 8 patients. This year, we will care for over 6,000 patients. For some of you here this morning, we've had the honor of caring for someone you've loved. Honoring special people in our life reminds me of a very brave young girl named Jasmine. In so many ways, Jasmine was a typical 12-year-old girl. She loved her family, her siblings, and her fabulous doll collection. But unlike other girls her age, Jasmine was unable to attend school, go to the movies, or play in a softball league. Instead, her friends were nurses. Her days were filled with chemo treatment, and she used what little energy she had to keep fighting for life. We gave Jasmine our very best care for over a year. As special people do, she gave us more than we could ever give her. And if love was a cure, the end of her story would be much different. Last month, she took her last breath. At home, surrounded by her family and hospice nurses. Jasmine taught us to live each day with courage, to open our eyes to the wonder that surrounds us, to protect the things we love, like her dolls. She inspired me. I hope her story inspires you as well. Jasmine's story has been repeated 548 times just this year. Other courageous patients without funding, without insurance, or any way to pay for hospice services. It costs Lifepath Hospice $2.5 million each year to care for the uninsured. This is over $200,000 a month in unreimbursed expenses, $6,800 a day. It's a number that keeps me up at night. How long will hospice care be able to operate at a deficit? And caring for those end-of-life patients is not the end of our mission. We also care for the grieving ones left behind. Did you know that 1 in 11 children will lose a parent or sibling by the time they're 18 years old? That's over 38,000 children in Greater Tampa. That number equates to about half the audience at a recent Taylor Swift concert here in Tampa. Ironically, the concert was the same weekend as our annual grief camp, Camp Circle of Love. Some kids were going to the stadium to see the superstar of their dreams. Our kids were going to a weekend camp to understand why sleep is so difficult since losing the one they love. Camp Circle of Love is a place for children who have said goodbye to a parent or sibling way too soon. I read the camp applications every year to understand the stories or their stories of loss. I was shocked to learn over half the children were impacted by an immediate and unexpected loss, a heart attack, a car accident, or a homicide. It was especially difficult to see 10% of the children share that they lost someone they love to suicide. Even though there are 44 synonyms for the word courage, I found myself speechless as I watched the children say goodbye to their surviving parent and board a bus that would take them away for the weekend to deal with their grief. Camp at our year-round grief center helped children find ways to express their sadness, loss, and anger in a safe space with counselors who understand. And thanks to many of you in this room, our grief and services are always free of charge, but not free to Lifepath Hospice. The cost to provide one-on-one grief counseling for children and adults, operate 2 grief centers, host weekend kids grief camp, and family day camp for over 3,200 individuals in need cost us $850,000 a year. Between these free grief services and charity care, there is a financial gap of just over $3.3 million. At Lifepath, we are challenged with ever-changing regulatory requirements, extreme staffing challenges, and a fragmented healthcare delivery system. The financial gap between adequate care by insurance standards and the right care by our standards literally takes my breath away some days. I worry that one day we may have to say no to someone who needs hospice care and doesn't have insurance, like the gentleman we have been visiting under the Crosstown Bridge for the past 7 months. The 46-year-old patient holding on to life, hoping to meet her first grandchild, and the precious 6-month-old baby who spent most of her short life defying the odds. And as cancer continues to be the #2 killer of children, we never want to abandon young girls like sweet Jasmine. And when it comes to healing a heart from a significant loss, we never want to tell a mom who lost her daughter or a son who lost his dad that individual counseling is just not available. We ran out of funding. We never want to look at a child in the eyes and say, we understand your heartache, but their center's closed for now. And as mental health crisis continues to climb, we know the loss due to suicide requires a unique approach to healing. It sounds simple to say charity care and grief services cannot be offered without generous individuals who care about our mission, but it's true. These life-changing, hope-making, courage-creating programs are available because of you. Your support and presence encourage us to leave our own families each morning and pour our hearts into the other families through the day and night. Your kindness encourages our spirits to keep going when the work we do is so very hard. You help us ensure that every story counts. Thank you.